Hi guys, my name's Katie Reiser. I'm in the RN to BSN program here at UK, and I also work at 4 Main at Good Samaritan Hospital. Today my presentation is going to be about acupuncture as a non-opioid pain management tool. The article that I've chosen is specifically from the New York Times, but it's also been on CBS News and Money Watch, and it talks about the opioid crisis more from a money standpoint. They estimate that 1 in 30 families is affected by the opioid crisis, either being an addict themselves or being affected from having an addict in the family. The cost of lost wages. The total economic cost of the crisis declared in 2017 was estimated at $631 billion, and that's just from 2015 to 2018. So in our practice, we see the opioid crisis affecting every aspect of healthcare, and that's another issue that has been greatly overspent as far as that. Excess healthcare spending has been over $205 billion as far as losses that are going to the treatment of these overdoses, the crisis as far as that regards, inpatient and outpatient well visits, and care for family members that are also affected by this, including children. Like I said, 1 in 30 households are affected by the opioid crisis, or they have a member of the family that is a user. It's also a drain on the legal system. So 3 of the big drug manufacturer distributors, American Bergen, Cardinal Health, and McKesson Corporation are some of the biggest. Johnson & Johnson and Teva have been reportedly offering a total of $50 billion to settle more than 2,000 lawsuits filed by towns, cities, counties to avoid going to trial. So like I said, we've got the cost of not only the victims but also the cities and the healthcare system that are losing these profits. Lifetime earnings are a big issue also, and that's where they get some of these numbers from, as some of the lifetime earnings that we're going to lose out because of mortality rates, because of people that are unemployed, because of damages to themselves, like I said, or died prematurely. Like I said, they estimate that from 1999 to 1970, from 1999 to 2017, the Centers of Disease Control estimate that nearly 400,000 people died from drug overdoses in just that 20-year period there. So what is acupuncture? Acupuncture is one of those things that a lot of people feel taboo about, like I said, scared of needles. But it's actually one of the oldest medicines known to man, and it's still used even here at UK. It's a great resource. So it's one of the most widely used medical practices in the world. It involves the use of very fine needles or filaments about the width of a human hair, so it's not like we're sticking an 18 gauge in these people. It's inserted into the skin at specific key points, and it's been shown to improve physiological functioning of the body through biochemical and nervous system responses. So it's a great way to let the body heal itself. So as far as my learning plan here, the target audience could be anybody who's dealing with chronic pain issues. So it would be great in our inpatient environment here in the hospital. It'd be something good to discuss with any of these patients that are not getting relief from this long-term opioid use. So many of the patients that I talk to at the bedside, they are taking these large doses of opioid pain medication, but it's not doing anything. They're taking it just for the pure addiction reason, for the habit of taking it. It's not solving any issue, and it's just perpetuating the problem. So like I said, we can address those with chronic pain. It may not be as good for a patient that's recovering from surgery and these acute pain issues, so I'm going to focus on the chronic pain conditions. An estimated 20.4% or 50 million of American US adults have chronic pain, so it's a huge part of our population, and had high impact chronic pain, where they were using most higher chronic pain medications such as the opioids. Excuse me. And it's also a lot higher in women, older adults, and those patients that are living in poverty. So that's a lot of our patient population that comes into the hospital too. Non-traditional pain management is great for that, like I said, there's a lot of options, but since I chose acupuncture for mine, it's like I said, something that would be great for them to try. Goals of my teaching learning plan. At the end of the presentation, the patient or the patient's family both will acknowledge acupuncture as a possible alternative to try for pain management and pain relief when other options are not working for them. In my specific learning objectives, cognitive, the patient will be able to list 3 benefits of acupuncture therapy for their chronic pain, and the patient will be able to judge whether this would be a good therapy for them or something that would be willing to try. So if you've tried everything else, there's no reason why we can't try this. Effective, the patient will accept written handouts on acupuncture therapy prior to discharge. The patient will also share one possible reason or barrier that acupuncture would not be a great option for their chronic pain management. Psychomotor, the patient will use internet to find practitioners near them, and we can also give them some information here. Like I said, UK has got a clinic that's right here within the campus that does acupuncture therapy, and we can try to help set them up with that also. But if not, if they live out of area, we can help them find some practitioners, and like I said, they can use the internet also to find some practitioners within their area within the next week following discharge. And the patient will schedule an appointment with an acupuncture therapist to discuss what they would like to see and the results that they would like to have within the next month. Evaluation. Cognitive learning will occur if the patient can identify some possible benefits of acupuncture therapy versus chronic opioid abuse for their pain management. Effective learning will have occurred if the patient can describe barriers to receiving acupuncture therapy for their chronic pain and accept information regarding the benefits of acupuncture therapy. Psychomotor learning will have occurred if the patient finds and then schedules a treatment for acupuncture. So, like I said, I think the biggest misconception about acupuncture is that it's painful, which that's not the case. Like I said, most people even people who are scared of needles, are describing the pain as more of like an achiness, a heaviness. Like I said, it's not a pain like usually associated with like a needle stick or an IV insertion. So like I said, it's not that kind of pain at all, and it's something that people don't need to be afraid of. For my handout here, like I said, and I'm going to set the link here, but it just talks about some of the different conditions that we can treat with acupuncture therapy. It's for a wide range of chronic pain issues such as migraines, joint and muscle pain, arthritis, neuropathy of the hands and feet, and menopausal symptoms. And other than maybe the menopausal symptoms, those are our patients. I mean, every single one of the patients that we deal with. Like I said, the key points that I put here about acupuncture is the biggest thing that we need to blow off the stigma. Like I said, it's not painful. This is not a painful procedure, and it can help the body heal itself. Like I said, that's how it works. It stimulates these areas and these biochemical responses in the body so that the body can heal itself. The great thing about acupuncture too is that this is not like yoga, this is not like exercise. These patients that tell us, well, I can't get out of the bed because I hurt too much, I can't do this because my knees are killing me, I have no cartilage left in my knees, I injured my back 20 years ago and I'm not able to do this. This is something that a patient can do laying on the table. Like I said, there's no barrier as far as the limits of physical activity to this. It is short term. It's not one of those things you're going to go for one treatment and be able to be like, oh, I'm cured, I don't have chronic pain anymore. And obviously opioids may still need to be used from time to time. Like I said, but this is a great resource for somebody to help decrease some of that. It's not for everyone. Like I said, you need to talk to your practitioner about it and make an appointment with your primary care practitioner or talk to the doctor before you leave the hospital. People who are on blood thinners may not be great candidates for acupuncture. Some things to consider, like I said, you need to discuss if it's a good option for you with your doctor. It doesn't replace medical care. It's an alternative therapy. It's not one of those things that's going to prevent you from being able to go to the doctor. You still need to do that. And you need to ask your acupuncture therapist about their experience and patient results, so they can give you a lot of information there. This is a great option for patients, like I said, to help with pain when nothing else has helped. I've got the links here to some information, and I'm going to post this handout online. And that's my discussion. Thank you guys very much for listening.